The Office of Information and Technology at the Department of Veterans Affairs is innovating its tech tools to support the overall mission of the VA. IT investment management can benefit both veterans and the VA. Leading that charge is Paul Brubaker. He's Acting Principal Deputy Assistant Secretary at the Department of Veterans Affairs, Office of Information and Technology. Paul, welcome to the program.
Hey, thanks, Mimi. Good to be here.
So tell me about the early days of the pandemic when there was obviously a big strain on the system. What was happening then?
Yeah, we were trying to organize to stay ahead of the demand that the system was generating as folks started working more remotely. The whole medical community was trying to treat folks using some of the telehealth tools that we had deployed earlier. And when the pandemic hit, it really stretched the system. We went from 59,000 unique users in a month that were doing remote access to over 175,000 a day. There was a lot of demand on the system, particularly on telehealth, as you can imagine, as our VA Video Connect system was fairly strained. And what we did is we worked really hard to stay ahead of the demand on the system. We were bringing in new medical practitioners into the system. We had to make sure that they got credentialed and outfitted with the appropriate technologies so that they could be effective on day one. Our average support time went from almost 2 weeks to get the equipment deployed down to 3 days. So we really stretched the system. We taught ourselves a lot about what we were capable of. I'll give you a specific example. We took a delivery of a hospital in Garland, Texas, from the Baylor White system. They donated it to the VA, and we were able to get the entire facility wired, get the circuits in, allow for wireless access points. We did all of that in 13 days. Normally, that's a 90 to 120 day process, and it's testimony to the partnership that we had with across the enterprise, not just VHA, but a lot of folks applying for benefits remotely. The Board of Veteran Appeals was doing telehearings. We had to accommodate all that from a bandwidth perspective. So it required a really close working relationship with our customers so that we could work shoulder to shoulder to deliver what everybody needed just in time, and stay ahead of that demand that the pandemic was putting on our system.
And that sounds incredible, but I wonder what the biggest challenges are that you're facing right now at the VA.
Yeah, well, the pandemic's highlighted a number of issues that we have with our technical debt, frankly. We had to work around some of the limitations of our existing infrastructure as we were deploying 21st century applications. And we've really been spending a lot of time examining the readiness of our infrastructure, where we need to invest so that we can put 21st century applications on that network, those that require significantly higher bandwidth to support. And we're building on what we learned during the pandemic with that expansion of telehealth and telework to help us address our infrastructure needs.
So now, what are you able to do to help with the large backlog of veterans claims that have really expanded because of the pandemic?
Yeah, and well, we're trying to stay ahead of that as well. And if you, with the toxic exposure, that backlog is projected to get even higher. So we're working really closely with the Veterans Benefit Administration to try to quickly deploy technologies that will allow them not only to stay ahead of that backlog, but to draw it down.
So give me an example of some of the technology that you're using to solve these problems.
Well, we're creating a lot of applications, mobile applications that face the veteran to really reduce the friction in the processes that they might experience in interacting with the department. We're doing a lot of human-centered design, where we're conducting focus groups. We're working with veterans groups to make sure that the systems that we're designing are easy to use, deliver results quickly, and eliminate the friction that the veterans have experienced in the past in interacting with the department.
So, Paul, how are you tying your IT modernization investments to actual outcomes? In other words, what data are you looking at, and how are you measuring the success of your investments?
Well, I'm glad you asked that question. We're going back to basics in some ways in our approach to IT investment management. And it's all based on understanding how the veterans use their system, the workflows that are involved in that, and then the current understanding of what we have. And then we work with our business partners, whether it's VHA, VBA, the staff offices, Office of Acquisition, even the IG, to work with them to try to co-create a future state that reduces friction, is much more efficient and effective. And what we're doing is we're creating roadmaps, segment roadmaps for each of the operating administration and staff offices, and allowing us to really systematically guide our investments in IT that have clear business value, deliver clear, measurable improvements in business and operational outcomes, so that we can better serve the veterans.
All right. Well, Paul, thanks so much. Thanks for your work on behalf of veterans. I appreciate you being on the show.
Pleasure to be here, Mimi. Thanks.